India is on a lockdown tomorrow in view of the COVID-19 spread, and if you're still wondering if social distancing is the way to go, please watch this video. I'm Dr. Sahana GV, Medical Director of Parvati Nethralaya, Bengaluru. There is a number called R0, which is the reproduction number for any infective disease. To explain it simply, R0 is a number and it shows how many infected people are going to infect further. That means from one person who is infected to how many more people will this infection go. So if the R0 is 1, then it means for every person infected, there will be one more person who is infected and it will continue to be in the community, but it is never going to become a pandemic. So this is true for the normal influenza. If the R0 is less than 1, then what happens is the infection eventually dies out and it is no longer seen in the community. For cases where the R0, for the diseases where the R0 is more than 1, it means every person who is infected is going to infect more than one person. So the higher the R0, higher is the spread. So when and this R0 is also dependent on 3 more factors. It also depends on whether there is a vaccine for the disease and has the disease been around for some time, and is there any way to kind of prevent the spread of infection. So there are diseases like measles, mumps with a very high R0 like 14 and 18, but we have vaccines for them and it's been there for some time, so it doesn't really matter. But when it comes to COVID-19, we do not have vaccines, it's a new disease, so the only way to bring down the spread of infection is to do social distancing. And the other news that's going around is the reason behind the lockdown is that coronavirus survives for 12 hours. So by having a lockdown of period of 14 hours, the chances of infection would come down. Though this is true to a certain extent, research has not proven up to what extent the coronavirus survives. So please stay indoors as long as possible. If beyond the lockdown period would be much better. And there are people who think, I'm young, I don't have any other diseases, I have a good immunity, why should I be following social isolation? So what happens is, irrespective of your age and your immunity, you can have an infection. Of course, if your immunity is good, you're going to recover faster. But as soon as you get an infection, you can still pass it on to everyone around you, your friends, your family. So please consider this a request. This is the least we can do to help the healthcare providers who are struggling day and night to contain this infection. All the workers who are out there tracing all the contacts of the confirmed cases. By staying indoors, we are giving them the best chance to give all these facilities to the people who need it most. We don't need to add to the numbers right now. It is going to spread leaps and bounds if we don't follow this, and this is the need of the hour, and I request you to do the same. I hope this information was useful to you, and if you want to be updated on more of this, please subscribe to my YouTube channel, Dr. Sahana JV. Thank you.